these days. Welcome to IPHA's third Thursday Lunch and Learn web series organized by the Iowa Public Health Association Education Committee. My name is Lena Tucker-Reinders. I'm the Executive Director of Iowa Public Health Association. I don't typically have blue hair, but I do today because I have 3 bored children who are locked in the house and we're doing the best we can. And so sometimes that includes playing beauty parlor with mom's hair. So that's where we are. We dedicate this time every month to sharing our successes and even some of the detours it has taken to get us here. Learning is always a process, and it's important to share no matter what the route that took us here. The point of these calls is to connect, learn, and strengthen the voice for public health here in Iowa. We're glad you're here today and hope that you'll be back with colleagues and friends every month as we do this. Today we're talking with colleagues in the work in the community health worker space. We have Deb Kazmerczak and Bill Applegate of Iowa Chronic Care Consortium, and Abigail, Chikak, and Vivian Aldridge with Dallas County Public Health Department. Again, they will all share from their different perspectives the role of community health workers within the scope of public health. Just a few housekeeping items. I have placed you all on mute at the end of the conversation. After Bill, Deb, Abigail, and Vivian have spoken for a while, I'll unmute everybody so we can have questions and answers. And we've also asked you to turn off your videos so that we can concentrate on those who are presenting to us today. So if you do have any questions during the conversation, go ahead and write them in the chat function. You can send them to me directly or to everybody. If you send to me, I'll be sure to raise them to our panelists, and then we'll get going. So let's start with the introduction of panelists. Vivian, I hopefully you and Abigail are together. If you just want to tell us a little bit about what draws you to the work of being a community health worker.
Hi, good morning or good afternoon, everybody, and thank you for inviting us. The why, the why I do this. I think it has to do with that I just really enjoy helping others. I really think that my curiosity and just being able to see sometimes that opportunity of that, see that change in a household or in an individual, just really kind of helps me to move forward in my work. I think that just knowing, like, understanding that every person has their own story and that sometimes some people just need a little help or sometimes people just need a lot of help. And so I'm just so grateful that I have that opportunity to be a part of that.
Great, thanks. Bill Applegate, how about give us a little bit of background on Iowa Chronic Care Consortium and your role?
Sure. I do a couple things here. I want to mention a little bit about what happened from our perspective. We, as some of you know, we do a lot of training of coaches around the country, and we observed, and those are usually healthcare professionals, and we observed, ironically, in the states of Massachusetts and in Texas, a lot of healthcare organizations were asking, could community health workers come into our coach training? And so that just kind of queued up the idea, what's going on in Iowa and what's happening here? And so with the help of Deb Kazmerczak, and she'll talk about it a little bit, we pulled together a group of stakeholders, about 20 plus organizations in Iowa, to take a look at what's going on in Iowa regarding community health workers, and there was not much. And so we felt that there was an interest, and certainly the Community Health Worker, Iowa Community Health Worker Alliance members or representatives thought there was a good deal of need for us to do something, and the greatest need among those things identified was really training of community health workers. And so we got into that in this way. But nationally, we're seeing a big surge in the employment of community health workers. And it's one of the fastest growing healthcare occupations. In fact, when you take a look at pre-baccalaureate, which a lot of community health workers are, they'll increase about 46% between 2000 and 2011. And that'll that's compared to about just 3% in the growth of all pre-baccalaureate health workers. So I think that it's really a targeted occupation, thinking in the period of 2018 to 2028, they estimate that there'll be more than 100,000 new community health worker openings. And that may be an underestimate.
Yeah, great. And so this is a great, timely conversation. So thanks for that, Bill. And we'll get a little bit more into the workforce side of things coming up here too. But Deb, how about we pitch it to you and introduce yourself and a little bit about what led your interest to this area.
Sure, thanks, Lena. So again, I'm Deb Kazmerczak.
Deb, could you sit a little bit closer to Bill's microphone there?
Is better?
There you go. Yep.
Okay, sure. So I'm Deb Kazmerczak, and I am an independent contractor. Have been working with Bill and the team here at ICC for 3 years anyway, a little more than that actually, just around building support and awareness for community health workers in Iowa. So what brought us together really around community health workers, Bill already gave the background that, they were training community health workers around the country. I worked at the Iowa Primary Care Association, which, as most people probably know, represent the federally qualified health centers in Iowa. And in that work and through some work with the safety net, we became aware of community health workers and the value that they bring to the safety net in terms of ability to really sort of connect with the client population. So it was just kind of a fortuitous conversation between me and ICCC that brought me to this work. And then for again, the last 3 years, we've been trying to raise awareness, build support, research, and then developed this demonstration project and training program that we'll talk about.
Great, thanks. And now, Abigail, you work with Vivian at Dallas County Public Health Department. What can you just introduce yourself and and just speak briefly to Dallas County's interest in having community health workers as part of the team?
Absolutely. So like you said, my name is Abigail Chikak. I'm the Community Health Administrator at Dallas County Health Department. And since 2010, we've had a health navigation program in our county to kind of address the needs of all of our residents. And we've really seen community health workers to be a valuable role in that because they're able to know the community and really act as a liaison between the residents of our community and the healthcare system as well.
Great, thanks. So we're going to just kind of continue on this conversation now that we've all introduced ourselves. I'm going to start with Vivian. As a community health worker, I imagine that no 2 days are alike, especially these days. But can you give us a general idea of the scope of practice of a community health worker?
Sure. So a general would be we have 3 times a week, we have team meetings that we come together with our supervisors and the other 2 health navigators that are here. And so we discuss our caseloads. We discuss, sometimes we come to a wall that we're not sure what resources is available for the client. So we kind of try to brainstorm and just to resolve and get to the next level. At that point, we're distributed the referrals that are coming in, and so then once we are assigned our clients, we contact them. It's entered in a database. We contact them and see what's best for them. Their time, their location. We really try to make that effort to go to the client. We have a screening that we work with that really addresses the social determinants, and so that kind of gives us a snapshot about what exactly, what kind of tools we might be needing to take with us or to be addressing. So we usually visit about an hour And then we come back and start working on things and just making sure, just doing a lot of research, seeing what would fit best for whatever is at need. And so then if the referral comes from a clinic, we really try to make sure that we do have communication with them and let them know where we're at with the client and what things are being addressed and what can't be addressed sometimes. And then follow-up, it's a lot of follow-up with the client, with where the referral came from, and just making sure that, you know, if they've applied for, just say for an example, for a dental application through the donated dental, it's just a lot of follow-up and making sure. Sometimes it could be a challenge for the client because they need to have certain IDs and they can't get to their library because of XYZ, and so we can go out, take a picture, bring it back, download it, scan it, and send it, and then it's done. So things like that.
So it sounds like, I'm glad you mentioned the social determinants of health and how we are looking at this as a broad spectrum of issues, and what people need to be healthy extends beyond the clinical setting. But just to be clear, so a community health worker is different than, say, a nurse's assistant or somebody who comes in to do home health care, correct?
That's correct. So our scope of practice, you know, of course, it's serving the Dallas County residents, you know, regardless of their income, ethnicity, age, gender, or race. So our scope of practice is to assist the residents to solve problems and access resources that are in the community that they can utilize that will give them a healthier life. So as I mentioned,
that's great.
Go ahead.
Yeah, no, I think that's a great explanation, because I think sometimes people who aren't close to the services, there can be confusion about who kind of does what. So Bill, you talked a little bit when you were introducing yourself about the workforce forecast for community health workers. Do you want to talk a little bit more about that, and perhaps how the need for community health workers overlaps with or integrates with, or maybe should integrate with, some of the other workforce development issues that we're looking at here in Iowa?
Sure. I think one of the things that a lot of people on this call and people in public health have known for a long time is that there are a whole bunch of things in people's lives, and maybe we'll call them social determinants of health, that actually influence health outcomes as much or more than medical care. Okay, well, now we have a new thing that's going on in this world, and that is healthcare providers and organizations are taking on more risk for health outcomes than they used to. And that comes from ACOs, it comes from different programs in Medicaid, a variety of things. So I think in the last few years, there's been an epiphany among healthcare C-suite people that, lo and behold, we have to pay attention to a whole bunch of things that go beyond the medical care that we provide if we want to influence outcomes, particularly for those people that are attributed to us, who oftentimes come from marginalized populations in the first place. And so what I think we're going to see as a trajectory here is a lot more medical care, healthcare organizations, both employing community health workers and encouraging and supporting public health and social service organizations to employ community health workers, because they need very much to connect these people to healthcare resources to address some of the social determinants of health. And some of them aren't, when I say, by the way, housing is a healthcare resource if you don't have it. I mean, it's pretty pivotal. And so what do I see in the future? Well, what I see is, this kind of indication of growth of community health workers being maybe more profound than we've thought, because of this, I call it the epiphany that healthcare has had all of a sudden, that lo and behold, there's a whole bunch of things outside of medical care that influence outcomes. So I think that's going to be the kind of driving force, not just for healthcare organizations, but also for other social service and public health organizations, to try to connect people, particularly those in marginalized populations, to services that have a big influence on people's health outcomes.
Great, I couldn't agree more, and it is good to see, you know, people kind of waking up to the idea that housing, education, transportation, employment, these are all health concerns, like you said, especially when you don't have them.
And I think another
yeah.
thing too, I think a big thing that we have known for a long time, but is just social isolation, which is an odd thing to be talking about now, but the point behind it is that we've known for a long time that was a big influencer of health. And I think you're seeing a lot more healthcare organizations starting to pay attention to that thing and actually finding some ways to deal with it. So,
right, it'll be interesting kind of what I think the lessons learned out of all this come out to be, and kind of how we adapt and adjust, and our viewpoints on everything from telecommuting for those who can to those who can't, and who is considered essential, and paid sick leave and social protection floor and all that stuff. It'll be really interesting to see kind of what comes out of this current situation.
great.
So we want to emphasize too that community health workers, it's a profession, it's a skill-based area of work, and as such, there's training that goes along that to help people in this field to kind of get them ready for the job. So Deb, do you want to talk a little bit about the training program that you guys developed and are working with DMAC on?
Yeah, sure. Can you hear me okay? I'm like on 2 screens here.
That's all right. We just get to see you twice.
Yeah. Sure. So we actually have been really fortunate to receive funding for a 3-year demonstration project. And there are really 2 parts of that. One part is we are like testing community health centers in a variety of settings across that 3 years. And then the second piece is development of the training program. And so there are 2 ways that the training can be accessed. We developed a registered apprenticeship program through the U.S. Department of Labor. That includes both on-the-job training as well as classroom training. And then the classroom training that is part of the registered apprenticeship can also be accessed as a standalone training. So same kind of core or classroom training, 2 different ways that you can access it. The training program is roughly 147 hours. After looking at curricula across the country, we selected the City College of San Francisco's textbook and learning guide, which is here. Trying to get it right so you can actually see it. Very excited about the curriculum. We just felt it was very contemporary. It is, however, for a full, I think, 2-year community health worker certificate program in California, so we have to scale it back to fit our needs. But great that it already existed. It's a really very readable, usable, user-friendly textbook, and so that is what our curriculum is based on. And it has kind of a mix of kind of practical knowledge, kind of the fundamental principles, things like boundaries, ethics, scope of practice, which Vivian mentioned, understanding behavior change, as well as a focus on skills-based training. You know, how do you do teach coaching skills in order to elicit behavior change in the client population. So both kind of, I would say, the practical and the really skills development part that really make community health workers good at what they do and good at connecting with the client population. So the course occurs, I showed you the textbook. The course occurs via live webinar over a span of 23 weeks. We supplement that just because we've got the grant funding and we can do it for now with some supplemental on-site sessions, which I can tell you the CHWs in cohort 1 really appreciated the ability to meet each other face to face and to meet with the instructor. So you log in on Tuesdays from 11:30 to 1 and have this kind of interactive session with the instructor and the other CHWs. Then there's homework assignments, quizzes that round out the training. So that's where we come up with the sort of rough estimate of 147 hours. At this time, so we had cohort 1 last year that they finished in March of this year, or excuse me, they finished in January of this year, and we're just getting ready next week to start the next cohort. And we will have, I believe, 11 people in the cohort 2.
Great. That's great. And this is affiliated with DMAC, right? Do you have a partnership with DMAC?
Yeah, so I'm glad you mentioned that. DMAC has been a great partner. Community colleges across the country are a great sort of a logical home for training like this. And as you look around the country, it is community colleges in a lot of states that are providing this training, not universally, but in a lot of states. So we have partnered with DMAC. They allow us to use their learning management system for the training, which is Blackboard Collaborate. They also award a non-credit certificate for participation in the training, so that if the participants then registered for another or enrolled in like a health or human services profession, then chances are they would get credit for this training toward whatever that certificate or degree is that they're pursuing. And really, we've talked with DMAC about the long-term sustainability of this training. Maybe this becomes a DMAC regular offering as part on the credit side, or a long-term non-credit program that they offer. So that's an active and ongoing sort of evolving partnership, I guess.
I imagine, as partnerships are. Great. I think what a phenomenal partnership that is. And if we could get that as a long-term training program, it would be to the benefit of so many.
It's really been good.
So Vivian, I want to get back to you. And so you've been working in Dallas County public health for a while. But my understanding is that you actually started working in the role of a health navigator, now community health worker, before this training, but then you did participate in the training. So can you talk a little bit about how the training has impacted your work, and kind of if your role in the department has changed, or just in general, how your experience with the training?
Yeah, sure. I really felt strongly that this training gave me, or gave community health workers a validity to the work field that I had been doing over 2 decades. And through the training, I learned the evolution of the community health worker, and how the government officials in our doctor offices, and how they're recognizing even more so the value of a community health worker. I think the training also helped me to really ask myself, identify that piece that was so important, the practice of scope. As an agency, as I was hired on, you wear so many hats, and so as things change in your community, you kind of just trying to, it really gave that concrete practice of scope and understanding that, and within our agency for myself, and recognizing even my own personal knowledge and my skills, and helped me to really identify those personal qualities and attributes that a community health worker has, and how to work as a community health worker, overcoming the health inequalities, understanding that the root causes of a problem is the very first step towards overcoming the barriers. And, we already knew that, I already knew this as I've been working, like I said, over 2 decades, but reading the text was giving me an understanding that health inequality is bad for everyone. And it really empowered me, and it made me to really think even more so, like, how can I help in this piece, in this world today? And so I also learned a lot about care management and client-centered counseling and so much more. But I think that self-check and self-care came up in there. Mindfulness is what, our work is, reaching out, helping others. So just reminding ourselves how, to keep that in check for ourselves. Like, I always love the analogy about, you can't help others if you don't help yourself first. And it's like that analogy of the airplane, the airplane's going down. You have to first put the mask on yourself so that you can help the other people. It helped me to reflect and keep asking those important questions, not only the things that I just mentioned, but the why. The why am I so passionate about my job, and how to keep moving forward in the fast-changing world where we're at today. The social determinants of health have found that the health behaviors and the socioeconomic factors are the primary contributions to health outcomes. So, yeah. Great.
I love that analogy too, and we all need to be reminded about self-care. And so I'm glad you brought up the issues of social determinants of health, upstream factors, equity, and such, because we all know that equity and health equity and reducing disparities has really become one of the tenets of public health, and it's part of all of our charge. And I know Dallas County does your community health needs assessment and your planning. So I'm wondering, Abigail and Vivian, maybe if you can talk a little bit about how the work that the community health worker does helps you meet your health equity goals, and helps you to reduce those disparities, and kind of rolled into that, like the decision behind prioritizing community health workers as part of the team at Dallas County.
I think that as we do our community health needs assessment and assess the needs of the community, it's always important to hear everybody's voice. And it's something that I've worked pretty hard on, successfully or not, but to try and get more voices included in our needs assessment and our health improvement planning. And I think that community health workers really strengthen that relationship that our department has with the community, because they are truly a liaison. And I think that's so important as we're seeing such micro-diversity in our state. We're seeing so many different communities all together in one county, and having someone from the community that can really advocate for people to really allow their voices to be heard, to help us as an agency to understand what those needs are and how we can address them, has been really important.
Great. I want to get back to kind of what we're looking at as the future of community health workers. I think everything that you guys have said, and especially that liaison, the link to the community, and I think identifying that we do have micropopulations here in Iowa. We don't have the most diverse state in the country, but we do have diversity. We have quite a lot of it. Sometimes it's what we describe as you said, Abigail, those micropopulations, but it's important to get those voices. And so Bill and Deb, I'm wondering if you want to talk a little bit more about kind of what is the outlook for community health workers as part of the workforce. What would you like to see? You're working on this training curriculum, you're working on your partnership with DMAC. What would you like to see in the next 5, 10, 20 years as we kind of evolve and move into our model of public health 3.0 and kind of that frame of thinking?
Sure. Well, I'll start, and then Bill will have thoughts to add as well. In terms of the outlook, if you look at the Department of Labor statistics for community health workers, they have a site called ONET, which is an occupational tracks changes in occupations. They give community health workers their Bright Outlook rating, which I think is their highest ranking. And anticipate that CHWs, as we call community health workers, will grow faster than average over the next 10 years. And so we have certainly seen that in other states. One of the things we found out immediately when we started researching CHWs is that Iowa is behind the curve. on bringing this workforce forward. So there is a wonderful resource via the National Academy of State Health Policy, NASHP. They actually maintain a state-by-state listing of CHW activity. And we have learned all kinds of stuff from that site. It's a nice state-by-state clickable map. And we can tell you that there are roughly 36 states have a training program of some sort. 20 have Medicaid or managed care payment structures for either reimbursing directly community health workers or allowing community health workers to be part of the reimbursable system. 22 have or are considering, I would say more of those are considering, state level certification for community health workers. 35 have a state level association or a state agency designated to support the workforce. 13 have some kind of CHW related legislation. So, you know, I guess we believe and have been acting on the belief for the last 3 years that it's coming to Iowa. We're just trying to sort of make it happen. And then by developing this training program, then we hope to show, you know, when the CHW activity level picks up significantly in Iowa, and it is changing and evolving, but then there's a robust training program in place. So there is some state level infrastructure. So when Iowa sort of catches up with the rest of the country, here we are, and there's a training program in place. You'll have thoughts.
Sure. Okay. So I think three quick things. One, I think what we see looking into the future is that there will be increased awareness and recognition to the role of community health workers. And that's kind of getting the word out about what things are happening. And in some cases, I don't want to say standardization, but it's really kind of a recognition and awareness of the variety of roles that community health workers play. And, you know, some community health workers their main jobs are navigating people through social determinants of health and health systems and things like that. Other people, other community health workers are actually working with individuals to address specific chronic conditions that they may have. But there's a wide variety of roles, but I think the first thing is awareness and recognition of what community health workers are doing. Second thing I think is important is that we have good enough training and skill development for community health workers that are in place and working so that their capacity is at a high level to do the things that are expected of them. And so one of the things that the Iowa Community Health Worker Alliance looked at is if we need anything in this state, we need training of people. And so I think that training and skill development is important. And then thirdly, I would really expect and hope that the organizations that hire them and policymakers do thoughtful evaluations of the impact that community health workers are having so that we can build a powerful case for an occupation in healthcare that's often kind of underrated and underestimated in terms of the impact that they can have. So that's what I see the future.
You bet. And I mean, it reminds me of that the adage, what gets measured gets done.
Correct.
So if we can show the impact, then the investment will follow. So finally, before we open it up the mics for questions, Abigail and Vivian, I wanted to turn back to you and just ask what advice you would have for other health departments or organizations, because it's not just health departments, we know nonprofits also invest in community health workers. What advice you would have to those who are considering adding community health workers to their teams? And especially Vivian, what would you have to say for people who are maybe interested in this line of work?
Well, I think that I would want to say that if they are interested, it's most definitely this training, this opportunity is something that really, really you would really benefit from. You know, when I started off my work, which was working in the community as a liaison, I was connecting to people. People were connecting to me. They knew that I was bilingual, and so I saw that there was a need back then, and so, you know, I really feel like it was a really nice, it's a really good feeling to be able to help people, and it's a touchy feeling, nice, you know, but as I realized even more so, it was more, my job was not only the liaison, but really came with a lot of accountability, responsibility, being that connection to our community. And I think that, you know, working under the Dallas County Health Department has been such a great opportunity to be able to do the work that I love. So if you really enjoy or have a passion to work with helping people to just have a better quality of life, this is it. And so I really would recommend taking this course for the community health worker.
And I would say that for health departments that have a lot of different areas that the community wants them to work on their needs assessment, the community health worker and health navigation in general is a really great way to bring all those goals together. So you're addressing housing, you're addressing food insecurity, you're addressing healthcare access, all in one program. And the community health worker role is essential in really addressing all of those needs without having to have a lot of separate programs.
That's a great wrap up and justification for that. I couldn't agree more. At this point, well, I'm going to take everybody off mute. If you have a question, go ahead and don't be shy, speak up, or if you want to write a question in the chat box, go ahead and do that as well. We've got about 10 minutes left of our allotted time, so go ahead and make use of that.
Battery's low.
Okay, here's a question. Vivian, now that with COVID-19 spreading across the state, and last reports from IDPH is that there's 5 confirmed cases in Dallas County, which is where you work, of course. How has this pandemic affected your work? And what precautions are you taking, and what role do you think community health workers will continue to play as the outbreak furthers?
Yes, so as a community health worker, it's different right now. We're no longer doing face-to-face, obviously, but people are still needing to connect to services. And so, number one, we're really trying to maintain very well informed so that we can share that information with our residents, as well as things have changed. Well, it would be like our team meetings have now changed, and our focus, you know, is around the COVID-19, and just keeping updated with that. Reaching out to keep, being creative with what we have right now. So with our technology and being able, like I said, people are still needing the services. So being able to scan things, take pictures of things, encrypt information that needs to go to the appropriate agency so that things can get started, whether it's aging resources, whether it's for Meals on Wheels, you know, whatever it is that a client might be needing to get connected to. So we're still doing the legwork, but it's all through technology. And you might think, well, why can't they do it themselves? It's because sometimes they just need that extra support to make sure, and that connection to advocate for the client and just get things kind of rolling in the direction so that they can have those services that they might benefit from.
Right, I think excellent point. You know, we hear so often people need to pull themselves up by their bootstraps, but sometimes we need help getting our boots on. So, and I also think that what we're going through now is going to expose a lot of those inequities, and it's great that you're able to kind of do this Zoom connection with your clients. But I imagine there's plenty of clients who don't have access as well, and I think that's one of the things that we're going to be watching and tracking as this epidemic progresses, and seeing what level of inequities is it uncovering for us.
If I can just add, like, you know, with everything that's changing, like the services are changing every day. You know, they were doing it one way, now they're doing it a whole different way. So it's just so important that our Dallas County residents are just really well informed, so that they're, you know, just to eliminate that stress that's already, you know, being already built up.
Hey, Lena, I have to interject a little too.
Yeah.
So
your issue that you have.
Oh, one of you's on mute. Let's see.
Yeah.
Okay, go ahead.
Just thinking a little bit about what the role of the community health worker could be right now during the panic that is occurring because of the virus. Because they're a trusted resource, you know, they're sort of able to establish that sort of instant credibility and trust among the target population. I think as long as the CHWs are armed with accurate information, then I think, you know, there's information everywhere, right? And you don't know what to trust anymore, but they trust their community health workers. So if they've got accurate information, I think that they can convey that, and I think they could have a really calming effect, because I think people are starting to panic, and who knows how much worse that's going to get. But that's where I see that they could just really be really valuable at a time like now.
Excellent point. Looks like Lori and Pearl, have you been trying to jump in?
Can you hear me?
Yep.
Okay. I just had a question, again, based on COVID-19. What kinds of things do you need that can support the work that you're doing out there for these folks? And but as we said, as Deb had said, you know, we know that this is just the beginning of the response effort, and then we're going to have a recovery effort after that. And just kind of trying to track out where we think we need to go and what's most supportive. Having that accurate information is one thing. Are there other things that are helpful, other bits of information, or more you want to be able to support you in the important roles you play? Because you are really building that resilience in the community, and having that connectivity to those individuals is really important.
So I'm not sure who that question is directed to, but I would think, you know, in addition to the sort of accurate information about what clients or patients can do, is, you know, ensuring that the CHW knows how to keep themselves safe and healthy. So that's a key thing that comes to my mind, Lori, with your question.
Perfect. Thank you, Deb.
And this is Abigail. I would say that the partnership between CHWs and the health departments, as CHWs are working with their clients and they're seeing the needs that are out there that may not have been there before, or that are different than before, it's important for us all to talk together and to make sure that we're all on the same page. That way we can work together to kind of address those needs as they develop.
You're right, staying current is a challenge, right? So.
Yeah.
And I would imagine too that this is really opening up people's eyes who maybe didn't have a relationship with their health department in the past, or see the connections, and that hopefully we'll see as a result of some of this as stronger partners across public-private, intersectoral partnerships, and realizing how interconnected everything actually is. Okay, I think we have time for maybe one more question if we have it. Okay, otherwise, thank you all. This has been a great discussion. It's so important to learn from each other and what our roles are in public health and the corona outbreak, you know, all this together. And we're so grateful that you have given up or shared your lunch hour with us today, and I hope that you'll come back for future conversations. So thank you to Bill, to Deb, Abigail and Vivian for sharing your thoughts today. Thank you for all of us who joined us and asked questions. We do hope everyone will join us again next month, April 16th. We are scheduled to have Angie Doyle-Scar and Derek Johnson. Angie's with IPHA. Derek is with the University of Iowa Libraries. We'll be talking with them about the great partnerships that exist between public health and libraries, and how libraries play an important role within public health as well. That's like what I said, that's what's on the docket. We'll see kind of how things unfold, and maybe we'll change up that talk a little bit for next month. We are still planning for the rest of the year. This is a project of the IPHA Education Committee. We are always looking for ideas and subject matter to share. We encourage you to get in touch with us if you'd like to share your work, or if you'd like to join the planning committee and help us move these along. As a nonprofit organization, Iowa Public Health Association does rely on our members for engagement, as well as our membership dues and sustaining donors to support our mission, which is to unite and strengthen the voice for public health in Iowa. If you're not already a member, I encourage you to consider joining IPHA. If you're a student on the call, do check with your department chair. Many programs are offering support for students to join their professional associations. And we are your public health professional association in Iowa. So with that, I want to remind you that all recordings of all of our Lunch and Learns will be archived on the IPHA YouTube channel. We'll get this one up as soon as we can. You can find other webinars there that you may have missed or want to share. So thank you, everybody, and we'll see you again next month.
Thanks for having us.
Thank you.
Thank you.